This presentation was organized by Christina as part of a requirement for HAP 725 taught by Professor Alemi in the Health Informatics program at George Mason University. This analysis is based on data available at the CMS's Hospital Compare site. All available data was included as of 8/18/2019. There were several limitations when doing this analysis. The first limitation was that data were not available for all years. Thus, the conclusions reached from this analysis could change as more data becomes available and we are able to see what the current state of the hospital looks like. In performing this analysis, only a select few measures of quality were used. There were other sets of measures available but were not used. Therefore, the conclusions for this analysis are based off of the selected measures used. We could have arrived at different conclusions if chosen to address additional measures. Control limits were chosen using a 95% confidence interval, meaning that we would expect 5% of the data to randomly fall outside the control limits. The last limitation is that the data was not case mix adjusted and may not reflect changes in the mix of patients at different hospitals. We could either have a hospital that received sicker patients in years where the outcomes fall outside of the control limits, or we could have the opposite. The hospital competitors of George Washington University Hospital include MedStar Georgetown Hospital, Sibley Memorial Hospital, Howard University Hospital, Providence Hospital, and United Medical Center. Looking at this first chart, the x-axis displays dates in which data on satisfaction rating were available. The y-axis shows the overall hospital rating within the quarter. The red lines show the control limits for the DC hospitals. These limits came from the variation of ratings across the DC hospitals that compete with George Washington University Hospital. George Washington Hospital has remained, for the most part, the same as the other DC hospitals in terms of patient satisfaction. There were only one time in 2015 that George Washington University Hospital scored higher. The x-axis in this chart shows the years in which data on serious blood clot after surgery was available. The y-axis shows the blood clot score. The red lines depict the control limits. These limits were also derived from the variation of blood clot scores across the DC hospitals that compete with George Washington University Hospital. George Washington University Hospital has remained the same as the other DC hospitals for the majority of the time, but did worse than the others in 2013. However, in 2015, George Washington University Hospital has a lower score than the other DC hospitals. The x-axis of this chart shows the time periods when data were available. The y-axis shows the rate of effective and timely care in the emergency room. The two red lines show the control limits, both upper and lower. These limits were taken from the variation of effective and timely care across the DC hospitals that compete with George Washington University Hospital. George Washington University Hospital and its competitors do not differ in the delivery of effective and timely ER care until the end of December 2017, where George Washington University Hospital did worse. The x-axis of this chart shows the time periods when data were available. The y-axis shows the rate of blood clot prevention and treatment. The two red lines show the upper and lower control limits. These limits were from the variation of blood clot prevention and treatment across the DC hospitals that compete with George Washington University Hospital. George Washington University Hospital and its competitors do not differ in the rate of blood clot prevention and treatment. The x-axis on this chart shows the time periods when data were available. The y-axis shows the hours of physical restraint used. The two red lines show the upper and lower control limits. These limits were from the variation of hours of physical restraint across the DC hospitals that compete with George Washington University Hospital. George Washington University Hospital and the DC competitors did not differ in the hours of physical restraint for the majority of the time, but George Washington University Hospital did have more hours in 2014. In summary, George Washington University Hospital was the same as its competitors in patient satisfaction, blood clot prevention and treatment, and hours of physical restraint use. George Washington University Hospital was also worse than its competitors in effective and timely ER care after September 2017. The George Washington University Hospital was better than its competitors in serious blood clot after surgery starting in 2015. That concludes my presentation. I hope you enjoyed it.